Hi, everybody. Today I'd like to talk about a particular case study. It's a really interesting example of things that can go wrong and how things can get missed in our patients. But it's a very, very easy way to understand some complex neurological issues and how they can be fixed very, very easily. So while we're specifically talking about one case, at the end of the video, I'll tell you how it relates to other cases and also to how we use some of the diagnostic tools when we're using the adjusting to neutral technique. So this is a case about someone who had nystagmus. This patient had a persistent nystagmus. So what that is when their eyes are sort of beating off to the side, so they can't actually fix their gaze. Their eyes are constantly doing this, and this particular patient had it her whole life. And one of the things that came out in the evaluation was that when I put her head in a position, the nystagmus stopped. So when her head was forward and to the right, the nystagmus stopped and her eye movements were relatively normal. So this is a very, very interesting key, and I want to explain why that happened and how that relates to other cases as well. So our brain gets information about where we are in the world by what we see, what our inner ear hears, and what our neck is feeling in terms of how the joints in our neck are moving. So in this particular case, what happened was she had a joint in her neck that was traumatized during birth, and her neck was basically stuck in that particular joint was stuck in this forward and to the right position. So one joint was stuck in that position and the other joints were functioning quite normally. So if you can imagine, in most positions other than that position, her brain is getting different information from different joints. So if one joint is twisted forward and to the right, it's always telling the brain that your head is pointed forward and to the right, whereas the other joints might be saying, no, you're pointing straight ahead. So when one joint is saying one thing and other joints are saying another thing, we're getting a disagreement between those input signals. And when we have a disagreement between the input signals, it affects our ability to know where we are and which way we're moving. And one of the ways that that was presenting in her particular case was her visual system lost the ability to stabilize. So in other words, when she was getting this aberrant information where one joint's saying one position and the other joints are saying another position, her brain doesn't know where she is, and she developed this nystagmus. Now there's much, much more to how that happened, but that's basically the simple explanation of it. What was interesting in the evaluation was I was checking different head positions to see how it modified her nystagmus, and when we found that her head forward and to the right stopped the nystagmus, what was happening in that situation was, yes, that joint that was stuck forward and to the right was still stuck forward and to the right, but what we did was we put all of the other joints forward and to the right. So what we did was we created a correlation and an agreement between what the head position which actually was. So when all of the proprioception from her neck was telling her brain that all signals within agreement with one another, she didn't have nystagmus, it disappeared. Now, many times we think about nystagmus as being a problem in the inner ear, and it can do as well, but the proprioceptive system and the inner ear bring their information together in a very, very highly coordinated way to be able to understand where we are and which way we're moving. So this was a really big key to me of that joint was actually a big contributor to her nystagmus. So generally in chiropractic, what we do is when we see a joint that's twisted, we'll kind of twist it in the opposite direction. So most adjusting is an end range adjusting. So that means we take the joint from wherever it is, and we try to feel where there's resistance of that joint moving. So in her case, that joint was forward and to the right, but she had a lot of extrinsic muscles. So in other words, this isn't when her head was forward and to the right. That's actually what was happening was the intrinsic muscles, the stabilizing muscles, were out of balance, such that one side was weaker or less capable of contracting, and then the other side was tighter than what it should be. So the joint was actually sort of wedged off to the side like this. So when that happens, her joint becomes unstable in that position. So the further she goes in that position, the less stability there is, because those muscles that are trying to resist that are not functioning appropriately. So what the body does to compensate is it will contract other muscles, we call extrinsic muscles, which are really designed to move you the other way. It will take those muscles and make them tighter to not only just move you the other way, but to try to do something to bring you back towards a neutral-ish thing, but also to try to keep you from going further into that position of that weakness, or further into that vector of weakness. So when we see this, what we'll actually see is that the joint doesn't move that way, and there's a lot of tension of other muscles, of these extrinsic muscles that you often feel on the top of your shoulders. So she was complaining about these issues, and we could see the tension in those muscles there. And one of the things, kind of old school thinking, was we want to decrease this tension because that's actually giving her a lot of pain and discomfort. And when we do so, you can do a stretch, you can do different types of therapies and stretch a joint in that direction to stretch those muscles, make the extrinsic muscles relax. And for a couple of days that will work, but then it will come back. And the reason it comes back is because those muscles are actually fulfilling a purpose. Your body made those extrinsic muscles tight to try to prevent the joint from going into that weakened position. So essentially, by decreasing the tension and the capacity of those muscles to contract, we're actually allowing that joint to go more into its unstable position. And in fact, some end range adjustments, we're doing that. We're actually driving the joint into that end range and unstable position. So with adjusting to neutral, we're dealing with these things in a different way. What we're doing is we're primarily looking at the intrinsic muscles and the stability first. So stability first is kind of a key phrase for us, and that comes down to what's functioning. We have to ask that question of what's functioning and what isn't functioning in that stabilizing mechanism. And then in this particular case, the muscles that we're trying to contract to make her spine stable and hold it in more of a neutral position were being affected by the opposite muscles, which again were too tight. And I go into that in other videos about how that happens, so check those out. But what was happening was these muscles were too tight. So what it was doing was the muscles on this side were too tight and keeping the joint from coming back to neutral. So what we do in adjusting to neutral is we create a very fast stretch on those muscles to get those to decrease their reactivity or their state of contraction so that they relax. And as we know, when you stretch an intrinsic muscle, it has potentially a long-term and lasting effect. So when we stretch those muscles, we can make them relax, and if everything else is able to function well, we should see that persists and that continues to function. That's why we don't need so many adjustments with adjusting to neutral. So when we adjust this joint, the muscles relax, and then when this muscle stops contracting, it stops inhibiting the other muscles, so then the muscle can start to contract and the joint can be more stable, and those muscles can work in more of a coordinated function to maintain the ideal biomechanics of the joint. So we were able to do this with this patient. I basically have a series of tests. There's 3 main tests that we do with head and eye motions and different correlations of head and eye motions. And after those 3 clinical tests, we can establish which joint is the issue. In other words, which joint is creating the proprioceptive error that is creating this type of an issue. And in her, it was a nystagmus. In other people, it might be other things. So we were able to establish which joint and which vector it was stuck in, and how to resolve that issue by driving it back towards neutral. So we're able to figure out, again, which joint and which way we need to move that joint in order to resolve that proprioceptive error. So in this particular case, all we had to do was just adjust one joint. It was simply one adjustment, and what we found was that the nystagmus stopped. So just immediately. So not only that, but all of the other issues, the balance issues, the digestive issues, the issues with her pupils not responding to light appropriately, and her photosensitivity, all of these things were able to resolve immediately. because there wasn't that disagreement between that sort of errors from one joint being stuck. And because this was at the top of her neck, that there's a high concentration of proprioceptors in the top of the neck. So it's like it's giving a lot of information and a lot of sort of power to the system. And if that system is off, it's actually throwing off kind of the powering and the quality of the signals to your brain. And you really rely a lot on those upper cervicals to know where your head is. So again, these joints being stuck was having a very significant consequence in her presentation in her life. So this is something that's very typical, and so we see this a lot. Again, sometimes people come with problems with hearing even, or people have problems with coordination or balance or digestive issues, and all of these things can play into how our brain is perceiving the sensation of where our joints are. So when we have a joint or a few joints that are kind of not in the right position or not moving as well as they should, and muscles are out of balance, however you want to call it, whenever this happens, what we can find is that it can affect our body in many different ways. And with the adjusting to neutral and the principles that we teach, we have some very clear clinical testing that we can do that helps us to establish exactly which joint is causing the problem and in which direction we need to adjust the joint to be able to get the maximum effect, and also to be able to give that patient a solution that's going to last. So anyway, I hope that's interesting to you. There's many other examples of how this works. I just wanted to bring a little bit of a case study to the discussion here and see what you guys think. If you like this kind of idea, I'll be happy to give more case studies. And yeah, just let me know in the comments. And thanks for watching.